So they'll report difficulty doing things like putting on their shoes and socks is a really classic one, or getting in and out of the car where they've lost the movement, lost the flexibility to be able to do those things. They may also have some stiffness in their hip joint, particularly in the morning, but the stiffness will only last a short period of time, and then once they get moving, the stiffness improves. And they may also have sometimes people with osteoarthritis also complain of like the locking or the catching in the hip joint, or the clicking and crunching in the hip joint as well. So, but particularly that loss of movement and some stiffness in the morning, as well as the pain in that area, and a history of FAI syndrome or hip dysplasia can suggest osteoarthritis. Also, if someone's had a heavy manual job, so if they have worked in a factory or worked as a farmer or something where the work is very heavy, that increases the risk of osteoarthritis. So understanding someone's occupational history is really important. And there's also a higher risk of people with osteoarthritis if they've done a lot of sport. So if they've been an elite athlete and played sport a lot, they also have an increased risk of developing hip osteoarthritis in later life. So using all of those things can help you come up with a diagnosis of hip osteoarthritis. So you don't need to get an X-ray to diagnose osteoarthritis. You can diagnose it based on those other criteria.